you for taking my question. The seroprevalence study done in two major cities in Mumbai and Delhi in India show that on an average, 40% of the populations in these cities have developed antibodies. What is WHO's view on this high seroprevalence rate? Thank you.
So thank you very much for this question. Yes, we are aware of these two studies that have been conducted in India. And in fact, we actually have a presentation from one of the groups presenting to us later this week, where we will get much more details about the studies that were conducted, how they were conducted, the tests that were used. It's very important that these types of studies are conducted in as many populations as they can. These are called seroepidemiologic studies, which are measuring the presence of antibodies from the virus, which indicates that somebody had been infected with the SARS-CoV-2 virus. So there are more than 100 studies like this that are underway globally. There are, at last time we looked at the end of last week, there were 31 published papers, peer-reviewed published papers, plus an additional 60 plus preprint papers or government reports, which are looking at the extent of infection in different types of populations, whether these are general populations or specific workers like health workers or frontline workers. What we are finding generally is that most of the seroprevalence results find that less than 10% of the population is positive, seropositive, indicating that they had evidence of infection. There is some higher seroprevalence in certain types of occupations like health workers or frontline workers who have had a higher level of exposure. But the two studies that you point out in India are indeed very, very interesting. And we need to look at a few things. One is the populations that were under study, if these are specific populations and if they represent larger, bigger populations. And secondly, what the type of circulation was in these areas where the studies were done and the assays that were used. So we will fold this into our general understanding, and we look forward to learning more from the actual researchers who are carrying out these studies later this week.
Yeah, and if I might add, I mean, certainly in India there's been a 35% increase in cases in the last week and over 25% increase in deaths. And as I said, India is really trying to beef up its testing regime. It's aiming for 1 million tests a day, which is huge, but it's getting there slowly at 600,000 a day. The worrying aspect of this is that the positivity rate continues to increase and is now at about 12.5%. So it does demonstrate that the disease is still circulating intensely. As I said, India is a very large country. It depends on where you are, like it does in all big federal states, but the disease is moving around. It's moving from rural to or urban to rural, back to urban. It's circulating efficiently in the population and clearly having a major impact in terms of cases and deaths. So it's not surprising that in very crowded cities like Mumbai and Delhi that there would be a higher seroprevalence rate, but as Maria says, we need to look at the exact population that has been sampled, because in many of these seroprevalence studies, and they're very well conducted, there are natural biases in who's sampled, and we'll need to just check on the peer-reviewed data to make sure that the numbers indicated are an accurate reflection of what we believe the population infection rate to be.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. We're coming up to the